Hello and welcome guys to my channel, the Success Association of Medical Literature. So today I am with a new video on the case study of surgical ward. Before I have made videos on clinical presentation, then case presentation, then case study of medical ward. Now I have came with the case study of surgical ward. Surgical ward, and my diagnosis of the patient was orchidectomy. Orchidectomy, what is orchidectomy? Orchidectomy means removal. Orchidectomy means the removal of a testis. Testis is the important, we can say important part, organ, like body part. It is in male reproductive system, responsible for the preparation of the sperms. So the testis, due to some complications in the testis, there is a removal of the testis. So there are one pair of testis, that is two testes are there in males. So removal of the testis is called orchidectomy. The testis may be removal of one testis or removal of both testes. This is called as orchidectomy. So this is again for the nursing students as a clinical assignment they have to submit to the college. So this is case study on orchidectomy. So let's start with what all we have to continue. College name, case study on orchidectomy, that is removal of testis. Remark, it was for 10 marks. Again I got 9 marks. Name submitted to, submitted by, and submitted on. Then starting with, as you all know, starting is health history. I will make one video and I will upload it as soon as possible, and the PDF I will upload, in which there will be the format about how to write. Like in every video you will see that there is a health history, then physical examination, then drug study, like all these details are there in my videos. So I will make one PDF, normal PDF, with only with the headlines of what all we have to write. Now coming to the health history, as we know, starting with the demographic data, all this detail, then the chief complaint which you will get in the file of the patient. This is history of past illness, family history, family tree, dietary history, health habits. We are having 4 main topic: personal hygiene habits. The video which I will prepare will be on the health habit for the 4 topics. Personal habits, this 4 topics. So I will make one PDF and I will upload it as soon as possible. So then coming to the socio-economic status, which will come with all these headlines. You can just go, you can stop with the video and you can just go through the video. आपको अगर चाहिए होगा तो आप stop करके देख सकते हो क्या है. Second, physical examination again, identification data, this detail, general survey, vitals, height, BMI, हेड टू टो एग्जामिनेशन. जैसे कि ये पेशेंट था ऑर्चिडेक्टॉमी का, तो ऑर्चिडेक्टॉमी हेड टू टो असेसमेंट में इंटीग्यूमेंटरी सिस्टम नॉर्मल, हेड एंड नेक नॉर्मल होगा, देन थोरैक्स एंड लंग्स नॉर्मल होगा, एब्डोमेन भी नॉर्मल होगा. Spatial considerations all will be normal, and spatial considerations will be normal. Spatial anorectal region, so as this was orchidectomy, removal of testis, so anorectal region will be disabled, like penis, scrotum, inspection, palpation. This was the small diagram which I have made. There is bilateral scrotal region, swelling at right scrotal region. Right scrotum of the male was swelled up, like there was a swelling. I have seen the OT also of the patient, like the surgery was performed by the removal of the testis. So there was a scrotum was totally, it was swelled up. Bilateral scrotal region, for which inspection was done, that was swelling at right scrotal region, size 8 cm by 6 cm. Redness over right scrotal region noted. Palpation, local temperature rising up, swelling site. Right scrotal region, tenderness noted, that is pain at right scrotal region. Translumination test was positive. Getting above swelling was positive. Provisional diagnosis was right epididymo-orchitis with hydrocele. What was the diagnosis of the patient? Right epididymo-orchitis with hydrocele. That is orchidectomy was the surgery performed for it. Spatial consideration was normal. Coming to the investigation, patient value, more 2 columns you have to write, and here we have to write the full forms, right? Full form, like HB means hemoglobin, RBC red blood cell, WBC white blood cells. You have to write the Na, sodium, potassium, chlorine, PTI and iron. All we have to write. Patient value, then here will be normal value, 1 column, and 1 column will be of remark. Then this is the ECG, X-ray, PTI and iron, scrotal examination was done, that USG was done. Coming to the drug study, so there are so many drugs. This is the way you have to write the drug in a horizontal format: trade name, pharmacological name, route, dose, action, side effect, nursing responsibility. More you can add, mechanism of action, then indications, contraindications. This is a shortly I have written. In other videos you can see that. Injection super safe and tablet Urimax. You can just go through it. Then is my injection MSET and tablet Planep, that is pharmacological name was iplerenane. You can just go through it. Then tablet Nicorand, that is Nicorandil, and tablet Foxiga, that is dapagliflozin. Then tablet paracetamol, that is PCM. You can go through it once. Then coming to the disease condition, this is the important part in every clinical presentation. The format is same: history, physical examination, drug study, Nanda diagnosis, nursing notes, health education. At last, as I said, I will make a PDF for it. Main thing is disease condition. So disease condition, orchidectomy, male reproductive system, starting with the introduction of the scene, that is introduction of the male reproductive system, then external genitalia, penis, scrotum, internal testes and all, sexual determination was there. Then coming to the male reproductive system, the diagram for it, prostate gland, testicles, the surgeries and all. Then orchidectomy, the definition of it. So you can just go through this also once. Orchidectomy is a removal of, defined as a surgical removal of one or both testes, and in the introduction and incidence rate, that removal of testes is 4.5 per 1000 males. Approximately 86% of cases occurs in male older than 10 years. Medial age is 15 years. Incidence rate in the India. Then pathophysiology, orchidectomy, CT, chest, abdomen, pelvis, orchidectomy, clear skin, alpha fetoprotein and B, HCG, yes, NCG, seminoma, that is the pathophysiology. Then causes, this is a book picture from the Lewis book, and this is a patient picture which was seen in the patient. Same way, clinical manifestation, that is sign and symptoms. This is a book picture, this is a patient picture. Diagnostic study, book picture, patient picture was there. So for which the patient details are this, and test done, observed value and the remark. You can just stop the video and you can just go through it once. Then this with the according to date on 4th September 2023, 5th September, 6th September, 7th, 8th September, after date of admission, this were the investigation done. Then management, medical management, surgical management, nursing management. Medical management by doctors, this were the medications given. Surgical management, this was a surgical management, that is orchidectomy, that is removal of testes. Nursing management is monitoring, assessment, Nanda diagnosis. Monitor, educate and evaluate will come under nursing diagnosis, which is important as being nurse. Coming to the nursing diagnosis, that is Nanda diagnosis, we have to enlist according to the priority. Nursing diagnosis, so I have enlisted according to something around 11, and from 11 I have explained first 5 as nursing care plans. So acute pain related to surgical incision as evidenced by facial expression of the patient. Hypothermia related to viral infection as evidenced by increase in body temperature above normal range. Imbalanced nutrition less than the body requirement related to inability to ingest food as evidenced by reported inadequate food intake. Insomnia related to environmental stimuli as evidenced by reports difficulty staying asleep. Risk for infection related to environmental exposure of invasive procedure. Anxiety related to change in health status as evidenced by increased stress, expressed concern about and regarding the health changes. Fatigue related to prolonged hospitalization as evidenced by lethargy. These are the 10 from which we have to explain, as we are giving 5 days of nursing care, so 5 nursing notes and 5 Nanda diagnosis we have to elaborate. So 5 Nanda diagnosis we have to elaborate, from which firstly I have taken acute pain related to. So this is the Nanda diagnosis we have to write in horizontal landscape format with 8 headings, that is assessment, nursing diagnosis, goal, expected outcome, planning, intervention, rationals, implementation, evaluation. Nursing care plan 1. Assessment, subjective data, objective data. Subjective data, what the client says. Objective data, what we see. Nursing diagnosis first, which is from here, acute pain related to. This was the first nursing diagnosis which I have taken over here, as acute pain related to surgical incision as evidenced by facial expression. Goal was patient pain will be reduced at the surgical site. Expected outcome, what was the pain, that objective data what I have observed, the pain in the numerical pain scale was 0 to 10 was 6, so my expected outcome was it will come to 3 from 6, so within 1 week. So this was the planning. I have made something around 1 2 3 4 planning, and more planning are there for the first diagnosis. First on the diagnosis for planning, you can just stop the video and you can check with it. 4 and there's a 12 planning were made for this. Coming to the second nursing care plan, subjective data, objective data. Nursing diagnosis was hypothermia, increase in temperature related to viral infection as evidenced by increase in body temperature above normal range. These were the 4 plannings. These are the more plannings. No, third, nursing care plan. Third, imbalanced nutrition, less than body requirement related to inability to ingest food, evidenced by reported inadequate food intake. This were the first four. You can stop the video and you can continue with writing. And these are the remaining. Keep food warm by using heat retaining dishes, then avoiding giving medication unless prescribed, provide a food in decorative manner, know the like and dislikes of client, assess client's need for oral supplement, assess the oral hygiene, give psychological knowledge, reassess the patient condition. This was nursing care plan 4. Subjective data, objective data. I'm now coming to insomnia, that is disturbed sleep pattern related to environmental stimuli as evidenced by reports difficulty staying asleep. So these are the first 4 interventions, that is plannings. And these are the remaining 11. I will made 11 for this Nanda diagnosis. Then lastly, coming to the nursing care plan 5th was subjective data, objective data. Now I have taken the risk for infection related to environmental exposure or invasive procedures. So these are the 4 plannings, 4 and 5th, 6th, 7th, 8th, 9th, 10th, 11th. Now after this we will start with our nursing notes. 5 days case, so 5 nursing notes we have to write. As you all know, I will just explain you with the one nursing notes: name of the patient, age, gender, ward, bed number, name of the surgery if there, so write orchidectomy, diagnosis right epididymo orchitis with hydrocele, date of the surgery 4/9/23, doctor in charge Dr. Nalaude and Dr. Supriya. So this was the date, first day of giving care, then medications, so as the patient was NBM, the bath consent was there, prepare for the OT test doses, why it was not checked, this was my teacher's has given this me. So this was NBM, like nil by mouth, the patient was going for the surgery, so patient was not given any of the kind of water, food, it was nil by mouth for last 12 hours before operation theatre. So this was 8 reported to St. Tarachand Ramnath Hospital, Pune. Then 8:10 entered male and female surgical ward. Then greeted sister in charge, doctor and patient. Bed was untidy and clean bed making dung. Patient was having intracathecular 22G on left hand. Urinary catheter was attached. Unable to sleep last night due to pain, maintain personal hygiene by his own, unable to maintain, he is able to do daily activity by his own. NBM from last night, assess sister for giving the IV medication, monitor the vital signs of the patient. Then at 11, assist the patient for taking positions. 12, assisted the patient, checked all the pre-operation third checklist and helped to transfer the patient to the OT operation theatre, observe the patient in recovery room after the operation. Also in the operation I was entered and I have seen the operation as well. This was the 2nd day, 3rd day, 4th day and 5th day of giving my care to the patient. Now this was the health education. Health education followed with diet, medications, exercise, personal hygiene, rest and sleep follow-ups, which was given to my patient and his relatives related to the treatment. Lastly, coming to the summary and evaluation, that is all the written things were completed, starting from the little bit of history, then the diagnosis, history, then admission, casualty, so he was brought, then admitted, then investigations were done, then it was diagnosed with dash, like diagnosed with this condition, that was orchidectomy. Surgery was prescribed. After investigation it was gone through the surgery, and I have given 4 to 5 days of nursing care. Like this was a summary, then conclusion, then the discharge planning was not yet done, then a prognosis. As in the previous video, prognosis is of 2 types: fair, good and bad. Prognosis means he was admitted in the hospital with the diagnosis of epididyctomy. Orchidectomy was the surgery, and if complications were there, so the prognosis will be bad, but the complication was not there, so prognosis was good. Bibliography for nursing care plans: Marilyn E. Dingor, Mosby, drug for the drug study, Javed Ansari for the medical surgical nursing, and this website I have gone through for this information. You can also go through. And this was my clinical evaluation. I have got 9 marks from 10. So this is my case study on orchidectomy. Thank you for watching my video.